The laser transurethral procedure is also done in the operating room under an anesthetic by passing a camera through the urethra, through the tube in the penis, into the prostate, and instead of using an electrocautery wire loop, a small laser fiber is used to vaporize the tissue and kind of open up a new channel in the prostate through which to urinate, kind of much like taking the core out of an apple. And the advantage of the laser procedure is that the laser is able to coagulate the bleeding tissue very well, so there's a lot less blood loss. So that procedure is done on an outpatient basis. Patients generally do not have to spend the night in the hospital. And they usually also wear their catheter a few days less than if they had the traditional TURP or transurethral laser enucleation of the prostate. Another procedure we do is office-based. It's called transurethral microwave thermotherapy, which means that we use microwave energy to heat up some of the prostate tissue and kill it. This is done in our office without an anesthetic. It's uncomfortable, so we give people a pain medicine to take before they come, but in general it's very well tolerated, and people prefer it because there's not a trip to the operating room which involves an anesthetic. The downside is that the office-based procedure also does not destroy as much tissue as the operating room-based procedures. During the microwave thermotherapy, people lie down on a table and we pass a catheter through their urine channel into their bladder. The part of the catheter that's in the prostate gland sends out microwave energy and heats up the prostate tissue and kills that tissue. And over time, that dead tissue turns to scar tissue and opens up the prostate. Patients will wear a catheter afterwards for several days, and they generally tolerate the procedure well. Some people ask, well, can the prostate tissue grow back? The answer to that is yes. As long as your heart's beating, your prostate is growing like mine is. So in general, after the TURP or the laser TURP, 10 years later, 90% of men are still doing great and that tissue has not grown back. 10% of men, however, the tissue has grown back and they're having symptoms again, and many of them will have to have some other procedure done. The microwave thermotherapy isn't as long lasting, so if the symptoms come back, it might only take 3 or 5 years before the tissue grows back and the symptoms come back. But that procedure can also be repeated, or someone could go to the operating room and have a more extensive operating room-based procedure done as well. There's not a lot of preparation that has to be done for those operations. For the microwave thermotherapy, we do an ultrasound through the prostate to get an idea of the three-dimensional shape of the prostate to make sure that the microwave field will fit inside the prostate. Common side effects from these procedures and from the BPH, or benign prostate hyperplasia, that's what we call that growth process of obstructing the prostate tissue, BPH. One of the side effects of those medications and the operations could be what's called retrograde ejaculation. That means when a man has an orgasm and the prostate squeezes, instead of the semen squirting forward out the penis to the outside world, the path of least resistance often becomes for it to squirt backwards. And the semen will squirt backwards into the bladder and mix harmlessly with the urine, and then will be expelled the next time the patients urinate. So that's, for some people, that's a good thing. They say, hey, less mess. For other people, they say, no, the semen's an important part of the experience. But for about 75% of men who have their prostate scraped out or lasered out, they will have that retrograde ejaculation. Some people could develop some scar tissue, which occurs in the prostate or at the bladder neck or in the urethra. That would eventually probably require another operation to fix. That occurs in up to 5% of people who have the TURP or the laser TURP. There could be some bleeding or infection with any of those procedures. Reported complications include urinary incontinence or erectile dysfunction. Nowadays, with the laser procedures, there's not as much erection problems as there was in the past. And also with the technology and the excellent cameras and fiber optic light sources that we have, also urinary incontinence is also much less common. The sphincter muscle, which is right here below the prostate, is what closes tight to hold our urine in, or relaxes and opens to let us urinate. So if that's injured during the operation, we could make someone incontinent. However, that's very uncommon now that we can see so well with our equipment. patients typically do not have any type of injury like that, although it is a reported risk. Another thing that could happen is some men will notice some temporary urinary incontinence after a procedure like a TURP or a laser TURP, because as the prostate grows and gets very tight, it actually helps hold the urine in, and this muscle atrophies or weakens because it doesn't have to work as hard. Once we scrape out or laser out someone's prostate, and all of the continence depends on that sphincter muscle, which hasn't had to work hard for years, it can take it a few weeks or a couple of months to get back into shape. And so some men, after we remove their catheter after a procedure for BPH, will have some urinary leakage when they cough or sneeze or stand up from a sitting position. But that typically gets better very quickly as this muscle strengthens up. That's an overview of the BPH, or benign prostate hyperplasia process, which causes men urinary difficulties. And I hope this movie's been helpful.